Why is it not? All right, we are now streaming on YouTube Live. Hi, everyone in Zoom and YouTube Live. I hope you're doing well. Welcome again to another workshop. Today we have Yasmin presenting on hemolytic disease of the newborn. So, Yasmin, whenever you're ready, you can begin.
Yeah. Oh my gosh, I can't believe you pronounced my name right. I just feel like everybody always gets it wrong. Okay. Let me zoom in and start presenting. Okay. So obviously my topic is on hemolytic disease of the newborn. Oh, why does this happen all the time? Okay, wait. There we go. So first off, my name is Yasmin. I'm a first year student at the University of Rhode Island in the United States. I am majoring in nursing right now, and one day I would like to become a mother baby / postpartum nurse. So if you have any questions on that, like URI or nursing, whatever, I'm only a first year student though, so I'm only doing my prereqs. So I'm not actually in the nursing thing right now, but if you have any questions, just, let me know at the end. But the first thing we're going to be talking about is red blood cells, because that's like the whole foundation. So then we'll build upon that. So the focus on this section is going to be what are red blood cells and what are their functions. So red blood cells, you can also call them erythrocytes. And they are one of the formed elements in the blood. So our blood is divided into plasma and formed elements. So plasma is like the fluid part. It has lots of plasma proteins inside of it. And it's mainly made up of water. And the formed elements would be things like your red blood cells, white blood cells, and also platelets. You could also call them thrombocytes too. And red blood cells is what we're going to be focusing on today. But if you want to know, platelets are important for blood clotting. So anytime you get like a scrape or like a cut on your finger or something like that, and the clotting of the blood is due to the platelets kind of like, pig piling on top of each other, and that just helps prevent, blood loss. And white blood cells are important in your immune system. I think I mentioned a little bit about white blood cells later, but red blood cells or erythrocytes, those are interchangeable. They are the most abundant blood cells in your body. And the function of them is to transport oxygen to your tissues and then transport carbon dioxide to the lungs. So essentially, red blood cells can hold carbon dioxide and oxygen. And basically, your tissues, they are undergoing aerobic metabolism. So your finger, your liver, whatever, all the cells throughout your body are undergoing aerobic metabolism. Some cells can go through anaerobic, meaning without oxygen. But generally you're going to have your cells undergoing aerobic metabolism, meaning they require oxygen to kind of do their little thing, do their processes. And then as a result, they produce carbon dioxide. And we want to remove that. That's a waste product. We don't want that. And all your cells require oxygen to do all their processes. So red blood cells, I like to think of them as like little buses, and they kind of transport the oxygen to many different locations. So like different bus stops, essentially, like throughout your body. So again, their whole purpose is to transport oxygen to the tissues that need it. And then they give it to the lungs, which, or they give carbon dioxide to the lungs that we can exhale, essentially. So when you breathe out, you're exhaling carbon dioxide, which is a waste product of aerobic metabolism. Hopefully that makes sense. And red blood cells, they're going to contain this protein called hemoglobin. And hemoglobin is like a red protein, obviously found in the red blood cells. And so I used to hear all the time when I was little that our blood is blue, but actually our blood is not blue. When your red blood cells don't have oxygen, so your blood is deoxygenated, that basically means that your blood actually turns like a darker red color instead of a blue. So when you don't have oxygen in your blood, that doesn't mean your blood is blue. That just means it's a little deeper of a red because there's no oxygen bound to the hemoglobin. So that's something also to note, that so thinking about the bus analogy, thinking of a red blood cell as a bus that transports oxygen. So the passengers would be the oxygen molecules, or even carbon dioxide too. But I like to think of hemoglobin as like kind of a row of seats. And I'll get into more of like what the seats actually represent. But hemoglobin is like a row of seats that can hold oxygen molecules inside of the bus, if that makes sense. And red blood cells, they are going to have biconcave discs, meaning that on each side, it's going to be kind of like indented. So you can see in the picture on the left hand side, they kind of look like little donuts because they're just biconcave on each side. And that just helps oxygen and carbon dioxide kind of glide onto the red blood cells a little bit easier. And they form this structure called ReLU. I don't know if I'm pronouncing that right. So if I am like butchering that, then, you know, you could tell me. But basically they form like little stacks of pancakes, and that just helps them move across the red blood cell. So you can see these like little stacks that just helps them move along the capillaries and the blood vessels and stuff. So that was really long to explain red blood cells. But erythrocytes, or red blood cells, they have hemoglobin. Like I said, it's a protein, and basically this is what the structure of hemoglobin looks like. And you can see in each hemoglobin molecule, you're going to have 4 hemes. So that's kind of the, if we're thinking back to the bus analogy, this would kind of be the seats, and this is where oxygen is physically going to attach to the, yeah, thank you, whoever like put that there. But yeah, so this is actually where oxygen is going to bind to the hemoglobin. So basically each hemoglobin molecule can fit 4 oxygen molecules because we have 4 hemes. And mainly, this is the like important part, is that you have this iron center, and that is where oxygen will bind to it. So this looks like a lot of organic chemistry here, but the most important part is that the iron is in the center, and that's where oxygen will bind to. So again, hemoglobin is like the seats on the bus, and or the rows of 4 seats essentially, and each seat would be a heme molecule, and a oxygen molecule could kind of sit on the seat, get comfy, and then ride to the next bus stop, maybe to your lung tissue or to your, you know, heart tissue or something like that. I don't know. All right. Okay, red blood cells. So how do they die? So your red blood cells only have a lifespan of 120 days. So they're dying rapidly. So basically we have these really big white blood cells called macrophages in our body, and they kind of eat the red blood cells before they explode, kind of. So that's called hemolyzing. And it's really important when a red blood cell dies that it does get eaten by the macrophage, and we recycle the iron. We love iron. That helps us make more red blood cells when we need it. You need a lot of other things than just iron, but iron is one of the main important things, because again, if you don't have iron, then, you know, obviously you can't make hemoglobin, and thus you can't make a red blood cell. So you want to recycle that iron within the heme of the hemoglobin. And when we take that iron out to, you know, store it, you know, and then maybe later on use it to make another red blood cell, it's going, that leftover hemoglobin without the iron is going to become biliverdin. And biliverdin then transforms into bilirubin, which you probably have heard of if you've heard of like jaundice or something like that. That transformation has a lot of organic chemistry. I was not into that. I was like, nope, I already have enough organic chemistry in my life. I don't need to look into that. So no idea how it transforms, but it, let's just say it magically does. And bilirubin is a orange yellow pigment, and basically it travels into your liver and then is excreted in the bile, and later it actually can come into your urine. So that's how your urine kind of looks a little yellow, is because of the bilirubin in there. So, you know, your red blood cells only have a timeline of 120 days, so, you know, they'll end up in your pee. Okay, let me keep going. Okay, the next section is going to be talking about blood types. So what are the 4 blood types and what are antigens are going to be the main focuses. So hopefully you can answer those questions later on. So blood types, basically on the surfaces of plasma membranes, you are going, or of cells. So cells will have this outer layer called a plasma membrane. And basically the proteins on top of that surface is called a surface antigen. For me, the easiest way to understand that is like a name tag. And every single cell in your body is going to have a little name tag. And it basically, that just allows every cell to recognize that as normal or as yourself. So if, maybe one red blood cell has a name tag, specifically says Yasmin, that other red blood cell must have that name tag that says Yasmin on it. And if it doesn't, then that is foreign and we need to attack it. So red blood cells, they have proteins that our immune system recognizes as self, like I just mentioned. And blood typing is basically understanding, okay, do you have a presence or absence of surface antigens? So there are so many surface antigens, but the main ones that like you kind of need to understand and you probably hear a lot is A, B, and Rh. So if you say, oh, I have blood type A, that means that you have the surface antigen A on your plasma membranes of all of your red blood cells. So all of your red blood cells will have this name tag that says, oh, I'm A. Or if you have B, then every single cell, every red blood cell will have a B name tag on it, if that makes sense. And Rh, it used to be D. This is called the Rhesus factor. And we usually indicate that as positive or negative. So for me, I'm A positive. So that means that I have both the A antigen and the Rhesus factor on my red blood cells. Hopefully that makes sense. So you can have different combinations. So you could be A, you could be B, you could have both A and B. So that means that your cells will recognize A antigens and B antigens in your blood. So if they see a cell that has AB, they're going to be like, oh, I know you. What if they only have A? Oh, I still know you. I recognize A, even though I don't know who the B is, but I do know who A is, so I still recognize you. Or if they were just B, they still recognize B because they have both of those surface antigens. So if they have both of the surface antigens, they recognize both. And O indicates that you don't have any surface antigens. They're kind of like bare, like they don't have a name tag. So if O received blood that maybe like, I don't know why you would give an O like A blood type, but let's just say that they got a transfusion, someone with O blood got a transfusion and it was A. And they would be like, who the heck is this? All the red blood cells would be like, who is this? This is foreign. I don't know you. So they would activate the immune system and attack it. But O is a universal donor because it doesn't have a name tag. So if A, let's say, got O blood, they would be like, oh, like, I don't even know who you are. You're a stranger. I don't know who you are, but I can't identify you. You don't have a marker. So I'm just going to leave you as is. I'm not going to touch you because they can't even recognize who it is. So if you want to like leave a comment and comment like what kind of blood type you have, if you know, and if you really want to get spicy, do you know what type of antibodies that you have? I can't read the comments. I don't really know how to do that. So I guess just do it if you want.
I could like read out the comments for you if you
Oh
want.
yeah, cool. You could do that.
Yeah. So I see a couple of people with O positive, O negative,
Cool.
A plus,
I've
B.
always been jealous of the O's, like just ever since I was little. You guys can donate to anybody, which is cool. Well, it depends. Actually, O positive can't, but O negative can.
Yeah, so there's like a good distribution of B's, B positives, O positive.
Cool.
Positive.
Okay. Glad you guys know that. Okay. So antibodies. So wait, let me move my thing. I don't know why it's not moving. Okay. So basically, let's say that you have an A antigen, surface antigen, an A name tag in your blood. So your red blood cells all have A. They recognize A as normal. But let's say they see a B and they're like, who is this? I don't know who this is. I need to attack it. So anytime we notice a foreign antigen, a certain type of white blood cell will release antibodies. And antibodies are kind of like, I don't know, I think of them as like spears, and like you're just like throwing them. And that's how they attack it. So each blood type, A, B, not O, I don't know why I put O. Oh no, not AB. I don't know why I put AB there. But each blood type will have a specific antibody that, is already made when we're born. So blood type A will have anti-B antibodies. So if you dissect the word, B or anti means against. So they're against B. So blood type A will be against B surface antigens. And so they'll have antibodies that are against B surface antigens. If you look at blood type B, you have antibodies that are against A. Blood type AB, since they recognize both A and B, they don't have any antibodies. So if they see an A, if they see a B, they're like, oh, well, I have you on my plasma membrane, so it's okay. I accept you. Welcome to the party. But then blood type O, they don't have any surface antigen. So if they see any surface antigen, they're going to be like, whoa, 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 who are you? You need to get out of here, and I'm going to attack you with my anti-A or my anti-B antibodies, or maybe even both if they're AB blood. So this drawing, I can't draw for my dear life. So and plus that's not what antibodies look like. Hopefully you kind of get that, but that's not what they look like. They actually look like Y shaped. And also note that antibodies aren't actually the ones that are detecting if a red blood cell is normal or foreign. It's actually going to be a type of white blood cell. And that white blood cell would recognize if that, red blood cell is normal. And then, if they detect it's foreign, they'll throw their little antibodies or spears to kind of attack it. Hopefully that makes sense. So you can see in the picture, I guess this plasma cell, or the type of white blood cell, to make it simple, sees this as normal. They're like, oh, the orange triangles, that's normal to me. So this could be like A, let's say. But then if this plasma cell sees B, or the blue squiggles, they're like, that is abnormal and we need to stop it, and we need to release antibodies in response. So I haven't really gone into the Rh blood group a lot. But if you are Rh positive, that means that you have that Rh surface antigen present on your plasma membranes. So let's say you're type AB positive. That means that you have A, B, and the Rhesus factor on your plasma membranes, the surface of your cells. And Rh negative means that you don't have that Rh factor. And a fun fact, which is actually not even a fun fact, but really important to understand when understanding the hemolytic disease part, is that when you are born, so if you don't have an Rh group on your plasma membrane, you're not born with an Rh antibody, an anti-Rh antibody. So you're not born with antibodies that attack Rh, plasma membrane. So they'll recognize it as foreign, but they don't have antibodies already made and ready to attack. I don't really know exactly why, but I guess we're not born with it. So like I said, we're not born with anti-Rh antibodies. And so when a cell sees an Rh antigen, let's just say maybe you got a blood transfusion, they accidentally gave you Rh positive blood, but you're Rh negative, you become sensitized or exposed to that. So it's like, I don't know, I guess the cells make a realization. They're like, oh my gosh, who is this? And they're like, okay, next time I'm going to get you with my antibodies. So they'll make some antibodies, but it's not as, a crazy response. They're like, I'm going to get my troops together for the next time I see you. So it's kind of like that. Okay, now we're actually going to get to the hemolytic disease of the newborn. So what is it? Why is this important for pregnant mothers to be aware of? Stuff like that. So I feel like a scenario would definitely be very helpful to understand this. So let's pretend that an Rh negative mother is expecting a little baby and the fetus is Rh positive. So during the first pregnancy, when the baby's in the womb, everything's great. You can kind of see that the placenta is separating, the two different bloodstreams. So you have the maternal blood supply here and then the fetal blood supply there. So you can kind of see those little spikes. Those represent the Rh surface antigens. And then here, she doesn't have any Rh surface antigens. So during the first pregnancy, everything's normal right now. The fetal red blood cells, they don't reach the mother's bloodstream. Everything is fantastic and wonderful. But then when the mother gives birth, the bloods actually mix. So the placenta, I don't know, I think it like breaks or something like that. I don't really know. Like, I'm not a labor and delivery nurse or anything like that. But basically the bloods mix during birth and the mother's immune system will actually activate. So the cells inside these certain types of white blood cells, they'll notice this Rh antigen and they're like, oh, whoa, I don't know you, but I need to attack you because you're foreign. So that will activate the mother's immune system to make these anti-Rh antibodies. So they become sensitized. But the baby leaves way too soon in order for it to, actually really make a big response. But they're like, next time, I have my defense team. I'm going to make my defense team. I'm going to get all my troops. So next time when I see this Rh antigen, I'm going to get you. So now let's, whoa. Wait, where was I? Okay, there we go. So let's say the mother is expecting her second baby, and this baby is again an Rh positive baby. So during the birth, so the pregnancy's fine, the bloods aren't mixing, they're all good. But during the birth, the bloods mix, and now the body's like, oh, I got antibodies for you. So they are attacking the baby's bloodstream, going crazy. And, this is not even like funny. I'm like making this a joke, but the antibodies are destroying the fetal red blood cells. And it's, I like to think of it as like when you first ride a bike. When you first ride a bike the first day, horrible. You have no idea what you're doing. You have to become exposed to, okay, where am I going to put my hands? Where am I going to put my feet? The first day, maybe you do a little bit of riding, but it's not anything crazy. The second day you go out there, you are a master. You are riding on your own. You're great. And that's the same thing with your body, is that when they're first exposed to something, even like a virus or something like that, they're not going to make crazy antibodies, and they need to become sensitized and understand and learn about this foreign antigen, make memories, and then be like, okay, I got you next time. And then the next time they attack, they go full force. So that's essentially what's happening here. So you can see the blood has mixed and now the mom is attacking, or not, well, it's not like physically the mom's like trying to do that, but the mom's makes antibodies that will attack the baby's blood. And they make it super fast, super fast. So hemolytic disease of the newborn, this occurs when the red blood cells of the fetus, they break down, and this is due to the mother's antibodies attacking. This can occur with Rh like positive, Rh negative, but even with like opposite blood types too. So if the mom was an O and like maybe the baby was an A or something like that, so this can actually happen in the first pregnancy too. So if the mom maybe fell during pregnancy and the blood's mixed or something like that, or she may have been sensitized already, maybe she got a blood transfusion or something like that, and she was exposed to Rh positive blood already, this could happen in the first pregnancy. So that's why we need to take action even in the first pregnancy and of course beyond too. So, the effects of hemolytic disease on the baby. So, the baby can die, unfortunately, due to very severe anemia. So, anemia is characterized by low hemoglobin, so that's what the HB means, or hematocrit, which is talking about like the red blood cell concentration. But basically, remember, if you are attacking those red blood cells, they're dying. And so that's going to cause less oxygen and less hemoglobin, obviously, because you're attacking those red blood cells. So causes low hemoglobin. That means that not enough oxygen can reach the tissues because, again, hemoglobin is like the rows on the seats. You have the heme, which is like each seat, and then oxygen kind of sits on each seat, and but obviously, if you are destroying all of those red blood cells, maybe taking away some buses, not enough oxygen is going to reach those tissues, and the baby could die from that. You need oxygen. And so the baby responds to that anemia by making immature red blood cells. So the baby makes red blood cells in the liver and the spleen. And so you can kind of see if you saw a baby who had hemolytic disease, their liver and spleen would be humongous because they're just trying to make as many red blood cells as possible in order to, get more oxygen to the tissues and prevent that anemia. But obviously it doesn't help because they're very immature and they're not good enough. And also note that when you're killing off these red blood cells, you have to remember how red blood cells die. Red blood cells, they are eaten up by those macrophages, and they eventually turn into bilirubin, and that gives you that like yellow orange appearance. And so that can cause jaundice in a baby, which is when that bilirubin builds up in the liver. And then also, hemolytic disease can cause paleness and a hard time breathing. It can even cause heart failure too, because they're really trying to pump as much blood and throughout the body. And obviously, the blood is made up of plasma and the formed elements. And the formed elements, remember, one of them was red blood cells. So if you are moving more of that blood, you're moving more of the red blood cells, which has the oxygen. But again, you don't really have much red blood cells, so they're not going to have a very easy time breathing, and they become very pale because of it. Oh my gosh, why does it do that? Okay, so can we prevent this? Yes, we can. There's actually a shot called RhoGAM, and it's given before, during, and after delivery. And this prevents the mother from creating anti-Rh antibodies. So that's why it's very important. And usually they take this even in their first pregnancy because, again, they could have been exposed to it sometime, in their lifespan. You don't really know. But this is really important for Rh negative mothers to get because it's more common. Again, I don't really know why, but I just know that it is a lot more common in Rh negative mothers. So basically, Rh incompatibility is much more common than ABO, so like the A, B, and O blood type incompatibility. So that's why a lot of mothers who are Rh negative, they need to get the RhoGAM shot. They have to get the RhoGAM shot or hemolytic disease will happen. So let's review. So red blood cells, their whole purpose is to carry oxygen and carbon dioxide. And antigens, they are the proteins on the red blood cells. And these are like little name tags and indicators. And you have very specific antigens on your red blood cells that your immune system recognizes as normal. And if they obviously see something that's foreign, they're going to attack it with antibodies. And antibodies are released by plasma cells, which are a type of white blood cell. And each blood type has a very specific antibody that will attack foreign antigens. So again, if you have blood type A, you're going to have antibody or anti-B antibodies. And in the scenario, I was kind of talking about an Rh positive baby, Rh negative mom. So unless the mother is sensitized or exposed to an Rh antigen before that pregnancy, the first pregnancy baby or the first pregnancy baby works. the red blood cells are not attacked because, again, the mom hasn't made antibodies until that moment. It was just exposed. You know, they don't really know how to attack it yet. They're kind of just, they make a little bit, but it's not anything crazy, and the baby leaves before anything crazy would happen. And Rh positive baby, Rh negative mother the second time. So the baby will be extremely anemic due to the hemolytic disease, the breakdown of the red blood cells, because the red blood cells are being attacked by the mother's antibodies. They're full force now. And RhoGAM is the shot that can be administered to prevent the mother from making anti-Rh antibodies. So that's all I have. Hopefully that was clear. Let me stop sharing. There we go.
Thank you so much, Yasmin, for presenting. That was so amazing. I know I looked over the presentation before, but I definitely learned more just by listening to you. If anyone has any questions, like, please feel free to put in the chat. Everyone just saying thank you and stuff.
Thank you, guys. I know the analogies always help me, like throughout anatomy. Ooh, they save me. They save me. I make analogies for everything. You're welcome. Everybody's so nice. Oh my gosh. I feel so appreciated. Thank you. Oh my gosh. I worked very hard on the presentation. If you guys have any questions other than, like, you know, anything, like, even if I don't know the answer, you know, just ask me, test me. I know, I definitely will use the bus analogy. Definitely help me. Anything at all. I don't mind. A quiet crowd. O negative can donate to everybody because they don't have that Rh antigen on it. So like if someone had, you know, Rh negative blood, or they didn't have an Rh antigen on the surface of their plasma membranes, they would have a reaction to the Rh positive blood, if that makes sense. So O negative is the universal donor, and then AB positive is the universal recipient. Let me see. Does the RhoGAM injection always work? Interesting. Honestly, I didn't look into that like at all. I hope it does. But yeah, I honestly didn't look into if RhoGAM injection always works. That's interesting. I should honestly look into that. Good question though. Jeez. Okay, you tested me there. I like that. Okay. What made you become interested in majoring in nursing? Oh my gosh, so many things. I feel like I've had, you know, so many nurses in my life. You know, my sister, she had like a home health nurse, and oh my gosh, she was like part of our family. And I kind of wanted to do something like that where I felt a part of someone's family and I really helped them through, you know, times that were really difficult, but also just be there for people that were, or that, you know, are going through something that is exciting, like mother baby nursing, you know? What blood types can receive O positive blood? So, okay, I like to just go through. I'm like, okay, so it has no has no surface antigens besides the Rh positive. So, let me think. Okay, Rh positive. I would say anything that why am I like blanking? I'm like blanking. I literally I know, write it down. Can you annotate? What? Actually, I think I can annotate. But okay, so you have the positives. That means so. I would say anything that has the positive, the Rh positive. So I would say like A positive, AB positive, A positive. I mean, you can receive O positive blood, but you're gonna have a reaction. You know, so I wouldn't do that. How has prereq nursing school been so far in terms of density of material? So it's okay. Obviously you're gonna have times where you're like struggling and stuff like that. But I do try and make sure that I always find time for breaks and stuff like that. That's so important. Like mental health, I always tell myself, I'm like, I don't want to look back and be like, oh my gosh, I was just studying all day. So I always make time for breaks. And honestly, if you just like set up a good schedule, always ask your professors questions, stuff like that, you'll do perfectly fine. Like I have a 99 in orgo right now, and it's just because I ask like 3,000. I'm not bragging, I'm just saying you can, if you just ask your questions, you'll do great, you'll do fine. Literally don't even worry about it. Why do people have different blood types to begin with? Oh my gosh, you guys are asking such good questions. I feel like I'm gonna say I don't know to like all of these questions. But I think maybe just for like I don't know, like distinguishing. I don't know. Why would people have different blood types? That's a really interesting question. Your girl's gonna be on Google Scholar later. I'll be like, what is this? Yeah, that is so interesting. You guys are asking great questions. Hmm. Why would people have different? I just want to answer this. Yeah, I don't really know, but maybe if anybody knows, that would be great.
They said it in the comments.
Oh, it's part of DNA. Okay, so yeah, maybe that. See, I didn't learn that in every time I ask my teacher, like anatomy teacher questions, like she doesn't know either. So it's okay. Like I tell myself it's fine to not know everything. But yeah, I asked her like where I asked her what artery brings like what is it, blood. Why am I blanking? What artery no, not artery, yeah, what artery gives blood to the lung tissue? And she just did not know. And I was like, you don't like what, you don't know what artery? You're an anatomy teacher, you have your master's. Didn't know. So I was like, okay, shoot. Okay, wait, what was the other questions? Yeah, I think it is the positive. How long is the entire process of nursing school and prereqs required? So it just depends on like what you're doing. So if you wanted to get, there's so many options. If you wanted to get your associates, that only takes 2 years. I'm getting my bachelor's, so that takes 4 years. And so the prereq, so for me, it just depends on the school. For URI, it's so different at URI. It actually only takes 1 year, and you kind of do the prereqs. You do the prereqs in the first year, and then you kind of do the gen eds like throughout the nursing program, if that makes sense. I do know that like other schools surrounding me, they do all the prereqs and everything in the first 2 years, and then the second 2 years is the actual nursing program. But for URI, you actually start clinicals and everything in the second year, which is interesting. But that's why I wanted to do it, because I wanted to start clinicals early, because I just love like hands-on stuff. Which one's harder, college or high school? Definitely. I don't. Wait, this is kind of difficult because I was like, oh, definitely college. But okay, I definitely think college was harder. I just think high school, I just didn't like high school, to be honest. I don't know. But I did like high school a little bit, but I just like all the people. But like college, yeah, I think high school definitely has a lot more homework, but college is a lot more studying. And you know, I guess that's nice for some people, but I kind of hate that. I think high school can be hard if you're taking a lot of AP classes, because I took an AP class. I literally dropped out of it like in the first week. I was like, your girl can't do this. It was hard. I was like, shoot, I can't do this, but I'm doing fine in college. So I don't know. I guess it just depends. um, Is there a blood type out there that isn't one of the regular ones? Yeah, there's tons of blood types. oh my God, I think there's like 48 other surface antigens or something like that. Craziness. You know, I don't have the time to read through all that, but there's 48 or something like that. Which AP class did you take? I took AP Bio, and no, never again. I can never do that. I was like, no, it's just not anything like I, was expecting. Like I don't like biology like at all. I'm more of a health science kind of gal, I don't like that. Did I skip a question? Oh my gosh. What question? Oh, on average, how large are your classes? Ooh, so again just depends on the school. URI is pretty big. So some of my classes are like 200, 300, craziness, but they're all kind of blank boxes on my screen. So there's like 300 kids and like, they're just all blank boxes or like black boxes. Yeah, they're pretty big. Some of the classes are small. I remember when I went there to one of the classes, it was only like 20 students or something like that. So some of the classes are tiny. It just depends. But generally, the gen ed classes are pretty big. But actually, that one was a gen ed. Writing, that was a gen ed, and it was small. So I don't know, just depends. Is that all the questions? Dang. You guys were asking really good questions. I was honestly like, wow, dang, I should have done more research. I was just going off of my like anatomy notes and a little bit of extra research, but oh, and registered nurse RN, she's great. And then you have the quiz. I'm like kind of curious, like what the quiz is on. Oh, I'm not scared. I feel like you guys will do great. Oh, I know this first question. With my teaching? No, I'm just joking. Thank you. Oh my gosh, so nice. Yeah, hemolytic disease is crazy. I didn't know about hemolytic disease until like, I don't know, like 2 months ago. And it was just, I loved learning about it. But like, don't even get me started on like fetal circulation because your girl's still confused. What advice do you have for people applying to college this coming fall? I definitely just think like reaching out to your professors, attending class. Don't even get me started on that. I know some people who do not attend class. I'm not gonna call out any names that I know, but they don't attend class, which is such a it's such a bad thing. TAs literally, oh my god. Oh my God. They are like angels. I love TAs. They will literally, you can ask them so many questions because some of the teachers that I know, they'll be like, actually one teacher, I don't really like her, but she told me that she can't tell me anything on the test. But then I went to my TA and I asked him what's on the test. He told me, we like each other. No, I'm just joking. Well, like he's nice. And then also like, they just help you like orgo, such a struggle. But like, if you just reach out to your TA, so important. Make a schedule, Google Calendar. You're literally copying my presentation. Oh yeah, my sister has a presentation. I don't know when it is. April 16th. You guys should go to it. She's great. Sometimes. But yeah, I'm kind of like saying everything that she's gonna be saying. But yeah, definitely just reaching out to your professors, listening to the lectures, going to class, asking questions. Oh my gosh, even if you sound annoying, it doesn't matter. Does not matter. Go to your classes, ask a bunch of questions. I always think I'm annoying, but then again, I'm paying for my education. So shoot, I'm going to ask as many questions as I want. I'm paying them money. They're not paying me. Yeah. I think it always asks for the email. I'm not really sure because doesn't it send you like if you filled it out?
Yeah, I think for this one, like the email is like gonna be like it's going to be automatically counted, so like you don't have to like actually type it.
Oh, that's interesting. That's cool. Oh, wait, I read it wrong. It said it doesn't ask for my email. Okay, I see. Yeah, that's interesting. That's cool though. One less step, one less thing to do. I feel like I don't even know what to say. Like, what should I talk about? I feel like this is a rant session for me. I'm like ranting. I'm like, college is stressful, but definitely, oh my gosh, it's a great experience. You learn a lot, and I think that's really fun. Like I love like challenging myself sometimes, you know. Sometimes I just want to break. But you know, sometimes you like the challenge, you know. Sometimes. But then again, like if you just saw my bed, I have like so much orgo. Oh my gosh, making notes literally. Oh my gosh, my tests are open notes for some of my classes, so use that to your advantage. You know, I have like all my notes all like highlighted, pretty. They're not actually that pretty. They're not like the aesthetic like Pinterest things, but you know, I'm too lazy to make it pretty. But they're highlighted, so that's a minimalistic. Yeah. They just like it makes it easier to read, but if it's open notes, you know, use it, you know. I will write everything down. I remember when my tests were open notes for some of my classes, or like you could bring in an index card. Oh my gosh. I would write so tiny. Oh my gosh, it was crazy. And then my teachers were like, how can you even read that? My friends were like, what are you doing? I'm like, listen, I'm going to do great. But then I would just sit there like looking through the flashcard being like, what the heck did I write? And I just couldn't even see my handwriting. So it was pointless. Yeah. Hopefully the quiz is easy. I'm like sitting here like, oh my gosh.
Yeah, it's pretty easy. I made it like
Okay, cool. Because I was like concerned because I feel like this topic's kind of more difficult because I know like there's some topics like I should have picked an easier one like, oh, healthy eating or something like that, you know, easy. So hopefully this isn't too stressful. You too. Thank you, Cyrus. You have a great day.
that was supposed to be a question, if not exclamation. It's so weird. Why is it not found?
I was, so I don't know if I'm like gonna go through with presenting this next one. Maybe. I don't know. We'll see. But I was thinking of maybe doing like just the nursing major in general and like just talking about all the there's so much you could I could literally sit there for like 5 hours just talking about what you could do with nursing, but there's so much. I wanted to do like the process, you know, get into that and maybe because I feel like everybody always, I used to think at least that, oh, I want to do medicine, I need to be a doctor. But there's so many freaking options in medicine, not only nursing, because I feel like nursing's kind of like typical too. But you know, you could do like occupational therapy, you could do like, you know, there's oh my god, there's just so many things. It's crazy. Ultrasound technician, really cool. You know, even like dental hygiene is one, and they make bank for like how short of school. But yeah, I was thinking of doing like nursing, just like nursing related. Yeah. Yes. Oh my gosh, I'm so happy that it's widening your knowledge. I feel like it is actually cool though. I wanted to do something kind of challenging because, you know, I feel like it's just like a good thing to learn about, you know, like new things that like, you know, because I feel like everybody does know about like healthy eating, like, you know, that kind of thing. So I feel like it's cool. I always try to attend the ones that are like a little bit more complex and stuff. Yes. Oh my gosh. If you guys like to see it, then I guess I'll do it. I didn't really think it was that great of an idea. I was like, maybe I'll do one because last time I did like the nervous system and stuff like that, which, now thinking about it, I'm like, oh, that's boring. Or I could do like the urinary system. I'm actually learning about that right now. It's pretty fascinating, actually. It's just about how you pee. So I'm like, that's interesting. We all pee, so why not? But
something we have in common.
that's all. Yes, we all have that in common. But nursing would be really cool too, because again, like I feel like, you know, medicine is something I used to want to be a pediatrician or something like that. That's like what I thought I wanted to do. But then, just thinking about all the nurses in my life, and I also volunteered at like a nursing home too, and I saw what they did, and I loved it. And also just watching videos too. If you don't know what to do, like watch a bunch of videos. Literally so helpful. You kind of see what they do. I was actually watching a show yesterday and I saw labor and delivery nurse, and I'm like, oh my gosh, that looks like so much fun. I'm like, I want to do that. There's a lot more than just, holding someone's hand with nursing. So I feel like I could kind of mention that too. Because a lot of people think you're just on the bedside, chilling with the patient. No.
Summer camp.
Oh my gosh, my sister wants to be a summer camp nurse. And I'm like, that's so cool. Like you can literally just be with kids in a summer camp and just like,
Travel.
you could even travel. You could be a military nurse. There's lots of options.
A cruise nurse.
That's why I'm saying I should just do a whole thing on that instead of, sitting here rambling. Is everyone good with it? I'm hoping it wasn't too bad. I'm like, I don't know what to talk about. Oh my gosh.
So good right now.
What do I talk about? Okay, if you guys want to see the nursing one, then I'll definitely do it. So, I guess I'll do it. I was like, I wanted to do it. I just think nursing's so cool. I'm so excited. I'm so excited to start clinicals next semester. I'm like, Thank you so much. That's so nice. I feel so appreciated. Your girl tried hard on this presentation. So I'm happy because I was like, I'm way too tired right now. Like, yes, clinicals sounds so fun. I'm so excited. Oh my gosh. I can't wait to play with the little mannequins. Oh my gosh, that's gonna be so fun. They have like little mannequin babies at URI, and like they have like a pulse and everything. It's crazy. I think the 3-sentence summary is just like, kind of just like overall, like what did I talk about in the thing? I was gonna say summarize, like, when you ask like for a definition and then you just say the word in the definition, it's like that wasn't helpful. Thank you so much. Oh my gosh, I was like really nervous about like it not being, clear enough. Did I answer your question, by the way, about the 3-sentence summary to the person that asked it? I know it was a direct message, so I'm not going to say who it was, but like, did I answer your question? It's just like, explaining, what I talked about in 3 sentences. Does that make sense? Like you just say whatever facts, they'll probably give you the points if you just say what I said. Oh my god, I'm like so tired. I need to stop going to bed at like 1 a.m. I just can't. And then I like wake up at like 7. Ugh. I'm like, I don't know what to talk about. You guys have anything to talk about? Okay. Great. Okay. Thank you so much, Club Med. Whenever you, okay, yeah. I was like, yeah, I think the questions are all done. Unless someone else has a question, I'd be happy to answer it. But if not, I will go. I'll wait another minute, just in case anyone has a question that's on their mind. I'm definitely gonna look up that one question about I think it was the O positive one. I can't remember. No, it wasn't O positive. Oh, Rogam. Yeah. All right, I guess I will go. Thank you so much again for this opportunity. I really appreciate it.
Thank you so much for presenting. This was so amazing. I
Thank
did
you.
really it, and I'm sure that everyone else did too.
Thank you so much. Well, have a great day to everybody and you. Bye.
Have a great day too. Bye. Oh, okay, so sorry. Oh, sorry. All right, to everyone in the YouTube live, I know that for people in the YouTube live, the Google Forms wasn't working, and I'm really sorry for that. If you have already emailed me, then you're good to go. You'll get credit. So I'll end the live on YouTube now, and I'll answer your question about Zooniverse.